Welcome to Dr. Imran's Official. In today's video we will discuss normal electrocardiography. Normal electrocardiography, often abbreviated as ECG or EKG, is a medical test that records the electrical activity of the heart over a period of time. A normal ECG typically shows a specific pattern of waves and intervals that represent the heart's functioning within normal parameters. Some key features of a normal ECG include P wave represents atrial depolarization contraction. QRS complex reflects ventricular depolarization contraction. T wave indicates ventricular repolarization relaxation. PR interval measures the time it takes for the electrical impulse to travel from the atria to the ventricles. QT interval represents the time it takes for ventricular depolarization and repolarization. A normal ECG can vary slightly between individuals, but deviations from these patterns may indicate cardiac abnormalities or other medical conditions. It's crucial to interpret ECG results in the context of a patient's overall health and clinical history, and a healthcare professional is typically responsible for analyzing and diagnosing ECG findings.